Hello, my name is Ken Hill, and I recently had INSPIRE surgery, as you can tell. And I'm not a YouTuber, so I don't make this all the time. My throat's a little sore, so it sounds funny. I decided to make a video about my experience with INSPIRE thus far and answer a lot of questions that I look for out there. There's some good videos out there about people talking, but not a whole lot of what to expect and how it actually feels. So, my experience with Inspire, I started off with all of us, like everyone listening to this video, being diagnosed with sleep apnea 4 years ago. Tried a CPAP machine for 2 years till I threw it on the floor one night and said, "The hell with it, I wasn't wearing it." And I thought I could get by, but I started waking up more and more and more, struggling for breath. So I was like, "This ain't working." So I discovered Inspire. So, for those who have not done it yet, here's the process. You go to your sleep doctor who did your sleep apnea, and first they run numbers. And there's several kinds of sleep apnea, and if you hit the right numbers, then they'll give you a referral to an actual doctor who can perform it. In my case, out of Virginia Beach, there's only one doctor in the whole 757 area code that performs this. So next, you go to them, and they basically do it in-office, explain everything what would happen if you were accepted as a person that could do this procedure. And in his office that day, he numbed my back of my drains, ran a tube down, looked on the camera, and took a look to make sure you didn't have no other kind of blockages, because if you did, then you wouldn't be eligible for this again. Well, I did not have any, so and after that, if you want to continue forward, you have to do a outpatient procedure at a hospital. It takes about 10 minutes. They basically put you to sleep, go in, put a camera down your throat, and they sit there and watch your insides and how it collapses. My understanding, if it collapses side to side, you're not eligible. Collapses top to bottom, it makes you eligible. Not only do that, they also count your stop breathing to make sure that you are really a patient that requires this, and it would do you some good. So the good thing is they make sure that this procedure would do you some good. So after that, they told me I was eligible. I went ahead to schedule an appointment, and it wasn't supposed to be till October. So I'm freaking out. I'm not a very, what's the word, anxiety-filled person. Normally, I just make decisions and roll with it. But the whole time I was thinking, wow, I'm putting something artificial in my body just so I can sleep. Is it the right thing to do? I went back and forth, back and forth. That's why I've been all over the internet. I was like, I got to think about this for 2 months. Got a phone call and they said, "Hey, we can get you in a week and a half. You want to do it?" So I quickly said yes, not fully thinking, but I said yes, thinking, well, I get it done. Don't have to think about it no more. No more anxiety. Well, that's not quite true. It's just more of it more often. It just so happens I found a couple things that help bring that level down. I happened to have a physical with my doctor that week, and he said, "Ken, what's up?" And I told him, because he had to sign off on it. He said, "Well, it's already having an artificial device in your body." He's like, people have knees put in their bodies, people have hips done, and girls have implants in the bottom and the boobs, and that's not even for health. What you're doing is basically adding years to your life by being able to sleep properly and breathe properly, and you're going to feel much better waking up. I was like, well, that makes sense. Looking at it that way, take away some anxiety. The second thing I did that also helped is I went online and I watched 3 different surgeons perform this surgery on YouTube. They have it out there. You can watch the surgery from begin to end. And if you don't mind watching that kind of stuff, I like it. So I watched them do the surgery and I was like, oh, that's okay. I can do this. I got it in my head. I can do it. Brought the anxiety level down some, because at least I knew what I was going into and what was going to happen. So we'll move on to surgery day. Surgery day, plan on being there, and whoever's carrying you 6.5 hours. I checked in at 6. I got out at 12:30. Even though the surgery for me lasted 2 hours and 10 minutes, you have check in, post-op, pre-op, whatever. The one big thing that I never knew, nobody ever said, no videos, no doctors ever told me. So when you go have the surgery performed, they have to intubate you, and that means they put a tube down your throat and the machine takes over your breathing for the process. And I asked them why, and they said because the cuts right here is so close to the rest of your mouth and stuff, and they don't want you to move at all. So they want absolutely no movement, and so they intubate you. And that's partially why my voice sounds like it is, because that tube just came out yesterday. So that was a big one on me. So 1 point, get some lozenges before surgery. You're going to need them. After that, the surgery was over. Sore, yeah. Pain, yeah. But it's tolerable. They send you home with 3 prescriptions. I had one of them is a antibiotic you have to take till it's over with, to fight off any infections. The second one they sent home was a painkiller, and it was hydrocodone with something else. I've taken a couple of them. I personally find I do better with just extra strength Tylenol. And they send you home with some anti-nausea medicine. A lot of people get sick from some of the meds. It doesn't affect me, so it's kind of a waste of my money for that, but it's here. That day, I pretty much went home and planned on sleep. I slept all day long. I got up, food. My wife said, "You hungry because you ain't ate since the day before?" I was like, "Not really," but she smartly, and I recommend this, she went out and bought me some soup and just soft, smooth foods that you can eat. Mainly, the only thing that's really sore is from here over. My mouth and throat wasn't sore besides that tube being down, but right here where they cut you, you feel it every time you take a step. So I recommend that you get some soft foods in your refrigerator before you have the surgery, or soft soups that you like. Mine was from Panera Bread. I love their tomato bisque, so it worked for me. It didn't eat a lot, just slept through the day. Like next day, they say don't plan on going to work for 2 weeks. I work from home, so I'm kind of in and out of my office. So I have done a little bit, but I found myself just kind of out of it. This is you keep looking at it. This is a suppression gauge or bandage. I have one here, have one here. You got to leave it on for 2 days, and you can't shower for 2 days. I guess it does something to pack this up, which this is more aggravating than the whole damn thing, really. Another couple points I've discovered. If you're right-handed, the surgery on your chest takes place in your right. My chest don't bother me so much as this does. This is really kind of sore. But I'm a stomach sleeper. That didn't work out so well. And when you're right-handed, generally when you're getting out of the chair, you push yourself up, it doesn't feel good. Or getting out of bed, it don't feel good. So if you have time and you ain't had the surgery yet, and you're going to have it, and you're right-handed, start practicing getting up out of your chair without using your hand, because, it'll come in handy. And I think that's about it. They did take x-rays at the end to make sure everything's placement. It's like I said, the pain is very, very tolerable, I think, but I'm tolerant. My anxiety is not 100% over, because, that one of my big anxieties was, will I use it? Because the CPAP, I couldn't. I was like, if I went through all this pain and money costing, will I use this machine? And I hope it's the case, because that's the last chance. We'll find out. This is a rather long video. My next one will be a lot shorter tomorrow. I'm going to do one of taking these bandages off so you can see how it feels, and I'm going to take a measurement of the scars. You can't see how it feels. I'm going to tell you how it feels when I take it off, this one on my chest. And we'll do a measurement of the scars. And so if you have any questions, any comments, feel free to send them out. And I hope that answers some of y'all's questions about that day and that procedure. Have a good one and sleep well.